Good evening. You're watching AWANI Tonight with me, Saraya Mia. The Auditor General's annual report reveals that Malaysia's national debt rose to over R1 trillion in 2022, a 10.2% increase from 979.81 billion ringgit in the previous year. It says the government has also narrowed its fiscal deficit to gross domestic product or GDP ratio from 6.4% to 5.6%.
According to the report, the federal debt consisted of 1.05 trillion ringgit of domestic debts and 29.51 billion ringgit of external debts. Domestic debts had increased by 10.5%, while external debts decreased by 0.7%. Meanwhile, revenue in 2022 increased to 294.36 billion ringgit, a rise of 60.6 billion ringgit compared to 2021. Majority of this came from taxes, which made up 70.9% of the total revenue.
The report also notes that Putrajaya spent 55.443 billion ringgit on subsidies in 2022, a 322.1% increase from the previous year. Subsidies for petroleum products recorded the highest expenditure, amounting to 45.184 billion ringgit, or 81.5% of the total.
The report said petroleum subsidies expenditure included RON 95, diesel and liquefied petroleum gas supplied by 15 manufacturers for claims between December 2021 until October 2022. The Auditor General noted that the subsidies were paid based on the retail price difference fixed by the government and the true market price. It added that the average global price for a petroleum drum has gone up to $100 in 2022 compared to $71 in 2021. Economy Minister Rafizi Ramli previously said the government was expected to save between 4.73 billion ringgit to 9.47 billion ringgit from its shift to targeted subsidies, which could begin as soon as the second quarter of 2024.
According to Prime Minister Datuk Sri Anwar Ibrahim, a shift to targeted subsidies will not burden the people. He says the move is necessary given that the government's subsidy expenditure has reached 81 billion ringgit.
Contoh terbaik ialah tabung haji dan kadar elektrik yang tidak akan dikenakan. Walaupun ada kekeliruan yang dibangkitkan seolah-olah kadar elektrik itu dikenakan kepada rakyat biasa. Tidak benar sama sekali. Dan kalau ada, mungkin ada sedikit pelanggaran dari peraturan yang ditetapkan. Tetapi saya tidak fikir mungkin kerana keputusan yang dulu oleh Jemaah Menteri itu jelas hanya pada golongan paling tinggi.
Malaysia is actively looking at increasing the use of the ringgit to reduce its trade dependency on the US dollar. The Prime Minister says the country has begun de-dollarization by using ringgit to trade with several countries.
Dalam beberapa sidang, saya bincang dengan negara China dan juga di ASEAN, Jakarta, meminta supaya kita gunakan wang, nilai wang tempatan, local currency, untuk berdagang. China sambut baik, jadi sekadar 20 ke 28% pelaburan yang besar sebenarnya, 10 bilion ringgit itu dalam tidak menggunakan dolar tapi menggunakan ringgit, dan ini tidak menjejaskan dari segi kehilangan atau kesusutan nilai ringgit. Begitu juga dengan Thailand. Setakat ini yang kita berjaya menggunakan local currency adalah Indonesia, Thailand dan negara China. Tapi tidak semua bidang, terutama kalau dia terlibat dalam commodity international trade.
The government must rethink how it delivers subsidies to ensure assistance reaches the vulnerable. Petaling Jaya MP Lee Chien Chung says this is one of the things that the government should prioritize in Budget 2024.
Few things that I expect. First is, of course, to have a more efficient way of channeling subsidy to the targeted people, meaning next year when we go out, the subsidy targeting those that are more vulnerable should be getting what they deserve, while at the same time it will also help in the coffer of the government. with the help of technology, data, and better targeting, I believe this can be done to make our assistance to the people more effective.
He said restructuring the targeted subsidy system in the country would be a win-win situation for the government and the people.
The government bears about 80 billion a year if the oil price stays high and stays elevated. So I think this is not sustainable. And at the same time, we also face the problems of smuggling, the problems of not targeting the right people. The rich enjoy more subsidy than the poor, which is ridiculous because, I mean, first of all, I don't think they need that subsidy. And secondly, the poor, where they need more, they are not getting it. So I think it's important to rechannel and also redesign the targeted subsidy system, or together with our social safety net, social protection system, so that the bottom of the people will be getting what they are deserving, while at the same time the subsidy shouldn't just be blanket.
Chen Chong also urged for a more comprehensive data collection system to identify targeted groups.
I believe PADU and the government is also moving away from this paradigm and to design a more appropriate data collection and categorization system, mainly based on disposable income. I think this is the single most important indicator. If you are living in town and compared to if you are outskirts, if you are double income earning family compared to when you are single, you have 2 cars and you have no car, I think all this will make a huge difference. So we need a more comprehensive data for the government or the decision maker to dispense the aids and social protection more effectively.
We'll take a quick break. Don't go anywhere.
Asking the tough questions is what we do every day here on Astro AWANI. Catch me every weeknights at 10:30 p.m. across all AWANI platforms.
Welcome back. According to the National Health Morbidity Survey, the prevalence of mental health issues among Malaysian adolescents has significantly increased in 2019 compared to 2015. With existing policies to tackle mental health, there's still much room for improvement, especially in terms of access to mental health interventions for relevant groups and sectors. To mark World Mental Health Day, we speak to Assistant Professor Dr. Muhammad Adil Zainal Abidin from IIUM on Malaysia's state of mental health and more.
Based on the National Health Mobility Survey among the adolescents, there's a very huge increment. We've got about 40% of our adolescents having a peer problem. In 2019, there's an increment of 10% jumping from 30% in 2015, right? And we also have other problems such as conduct issue among the adolescents. The prevalence is 15%, and the prevalence of emotional problems is about 8%. And I think this is just the number, the prevalence, but I think what we need to know is the key risk factor behind this. And it's very striking that the problem is more among the B40 income bracket groups and among the rural areas. I think that's more alarming. In terms of policy at the national stage, we already have a good in place. And I think last year, in terms of the budget, for the 2023 budget, mental health alone received about 35 million in terms of the budget. So in terms of policy, in terms of the budget is already good. And what more extraordinary is already this year, what we have achieved in terms of mental health is that we have the parliament, particularly have unanimously passed a bill to decriminalize the suicide attempt by removing the section 309 of the penal code, which punishes the suicide attempter.
As Malaysia anticipates the tabling of Budget 2024 on Friday, Dr. Adil urged for more accessibility of funds for mental health across all relevant sectors.
policy can go into the education, how we can educate, or perhaps we can incorporate in the education system, perhaps mental health education. Our neighbor Singapore have started 2 years ago incorporating the education. So perhaps the policy can go into our education policy as well. And the second thing what we can improve in terms of the policy is that there's quite a lack in terms of policy for mental health at workplace. But some of the government agencies have complemented this. For example, SOPSO recently, I think 2 or 3 years ago, they came up with policy to support employees who somehow invalidated with mental health. So they have included mental health in the list of the diseases for the invalidated scheme. Before this, it's all the NCDs such as diabetic, accident, right? So now they have included mental health in one of the lists of the diseases for the invalidated scheme.
On the foreign front, the death toll from the fighting between the Hamas and Israeli military has climbed to over 1,600, including 770 Palestinians and 900 Israelis. The death toll includes 6 journalists who were killed in Gaza since the fighting began on Saturday. Journalists attended a funeral procession on Tuesday for 2 colleagues killed by an Israeli missile that hit a building in the area they were reporting from. Israel said on Tuesday it had reclaimed control of the Gaza border as it continues to pound the besieged enclave with fiercest airstrikes in the 75-year history of conflict. Hamas claims to be holding more than 100 hostages, including Israeli army officers. Israel has mobilized 300,000 troops, its largest mobilization since 1973, when it called up 400,000 reservists. Authorities and humanitarian groups in the Gaza Strip warned that the territory could be on the brink of a new humanitarian crisis if supplies are not allowed in. On Monday, Israel declared a complete siege on the territory, saying electricity, food, fuel, and water would be cut off.
The area is home to about 2.3 million people in total, 80% of whom rely on humanitarian aid, mainly due to the ongoing hostilities with Israel.
In Gaza, damage to water, sanitation and hygiene facilities has undermined services to more than 400,000 people. The Gaza power plant is now the only source of electricity and could run out of fuel within days.
The spokesperson said more than a dozen healthcare workers had been killed or injured, and at least 7 medical centers had been damaged. He added that the World Food Programme was already distributing food for up to 100,000 internally displaced Palestinians, and that these efforts would increase 8-fold in the coming days. Since the attacks began on Saturday morning, Israel has stopped all supplies entering Gaza, including food and medicine. The Gaza Strip is ruled by Hamas, but Israel controls the airspace and its shoreline. It also restricts who and what goods can cross its borders, while neighboring Egypt strictly controls what or who can pass through its border with Gaza too.
In other news, police in Peru have arrested 6 Taiwanese and 2 Peruvians in an operation targeting a fraud ring. A total of 43 Malaysians and 1 Taiwanese who were trafficked into the country have also been rescued.
A raid in the La Molina neighborhood in the capital of Lima uncovered a telecommunication fraud run by a crime group named the Red Dragon from Taiwan. The suspects were accused of human trafficking, labor exploitation and extortion. Those rescued were reportedly lured to Peru with the promise of work at casinos. But upon their arrival last September, they were forced to give up their passports and prevented from contacting relatives back home. The group were then forced to pose as bank employees, justice officials or police officers, while making phone calls to companies in Malaysia and Taiwan to demand money.
Now that wraps up Awani Tonight. Thank you for watching. I'm Soraya Mia and we'll see you again.